Okay, good afternoon. We are Texas Health Resources. We're going to go ahead and start off with introductions. My name is Sarah. I am CFO of Texas Health.
My name is Fredy. I'm Vice President of Texas Health Resources.
Val, Director of Human Resources for Texas Health Resources.
I'm Lauren, and I'm Director of Research at Texas Health.
So go ahead and raise your hand if you received a flu shot this past cold or flu season. Like high, raise it high. Like I did not, so I'm not going to raise my hand. Okay, so look around the room. Just keep your hands raised for a second. Look around the room. That's a really small number, you guys. So you guys who raised your hand, good job. You guys took preventative steps to prevent the cold and flu from yourselves and from your coworkers or your peers. That leaves us with a problem for some of our lower privileged families. We're going to pass it off to Fredy to tell us why.
Here at Texas Health Resources, we have a little saying that says, healing hands, caring hearts. We care about all of our patients that come into the hospital that have any type of flu activity that can lead to serious illnesses later on in the past medical life that you have. But a lot of people are not very well privileged as much as some others are. So the lower privileged have a hard time seeking health care, and that can lead to a lot of cold and flu viruses spreading all around. Even as you are sitting right next to each other, one person can have the cold and just pass it on, and it just spreads like wildfire. And we at Texas Health Resources want to prevent all that from happening. We had the Affordable Care Act passed on by Obama, and that helped many lower privileged families take on the effect that that health care will be provided for them at a low cost rate. And many lower people that have health care do not want to take advantage of this, and mostly because of the high premiums or because they cannot afford it. And here with Go Care Clinic, we want to make it the availability of having flu shots and cold medication provided to everyone as well. As far as anyone's concerned, how many of you have actually looked at a bill provided by a physician to see how much they're actually charging? Anybody? Very low. I am the vice president, and I kind of know how this all goes. As far as I'm concerned, the Affordable Care Act pays doctors very low with their pricing that they make whenever you come in for a visit, if you're underinsured. Most doctors will charge between $150 to $200 per visit. And what the Affordable Care Act does, which is kind of influenced by Medicaid, is they provide such a small amount of money that doctors cannot afford to keep some of their practices going, because Medicare, Medicaid, and the Affordable Care Act provided by Medicaid will not only pay them like around $50 to $40 to $30, depending on what the client went in for a visit, but they also want to keep the low payments very low for all the doctors. And Texas had the availability to reinstate Medicaid into a full effect. That way the government can provide more benefits to them. But Texas did not want to provide this type of reissue. So what happened was Texas is going to lose around $100 billion worth of health care coverage provided by the federal government, and which will lead to a lot of underinsured hospitals that have lower underinsured people coming in to have more availability to them. As far as statistics go, I want to provide Lauren with the availability of how influenced the cold and flu season is.
Okay, if we look at this first chart, it shows us the months of the year when doctors' visits for cold and flu is highest. Since 2012, the peak of the season occurs around December. With our mobile clinic called Go Care, we will operate at the beginning of the flu season, October, and will continue through February. Looking at this second graph, we have a map of Texas. The different colors represent the influenza activity throughout the state. Dark blue represents flu-like illness, while red represents the combination of flu A and flu B in the areas. Looking at the map, we see Dallas County is red as of February 13th, 2016. With GoCare, we plan to target Dallas and its surrounding communities with the highest levels of influenza activity. As I said before, GoCare availability will be available October through February. We want to be available 3 days a week, Monday, Wednesday, and Friday from 9 a.m. to 5 p.m. And we want to target lower privileged communities in the DFW area. Now I'll hand it off to Val.
Okay. As Fredy mentioned, our GoCare clinic will be in the lower privileged community of the DFW area. And one of our biggest goals is, of course, to make sure that students and parents are healthier. But one thing that we're hoping is that healthier students will go to school more and cause attendance rates to soar because they're not missing class or whatever. And hopefully, that'll increase funding in public schools. And another effect of this is that parents won't have to stay home and take care of sick kids. And then they themselves will get sick, go to work, get sick there, or you get their coworkers sick, and cause a domino effect that decreases productivity in the workplace. So we will be providing over-the-counter medicines, flu shots, of course, and other preventative care meds to increase school and workplace attendance and productivity. So for marketing, one of the biggest things we're going to be doing is using the radio, of course, doing interviews and commercials to get the word out, make sure everyone knows about us. Of course, newspapers, people still need that. And in order to push our cause, we use social media with hashtag DFWGoCare.
Okay, so now we'll go ahead and talk about the budget. Our total budget for this proposal is going to be $80,000. To go ahead and emphasize what we are doing is going to be a mobile clinic. Our clinic's name is going to be GoCare. This clinic will be during the months of October through February, during the most severe cold and flu season months. Again, we're proposing it'll be about $80,000. Us as Texas Health Resources, the American Red Cross of North Texas, CVS Minute Clinics, and the Dallas Chamber of Commerce, we're all asking to go ahead and just split this cost evenly. So about $20,000 per piece, or per center. Texas Health Resources is going to donate $10,000 for the salaries of 1 physician's assistant and 2 registered nurses to head this clinic for 3 days a week during these 5 months. So as you can see in this pie chart here, our highest cost is going to be the RV and its renovations for $52,000. So we plan to purchase an RV for about $45,000, excuse me, a Class A RV, so it's going to be a little bit nicer and a little bit bigger to kind of support the amount of families and the amount of traffic that we'll have inside of our clinic. So besides that $45,000, about $5,000 to $7,000 is going to be used for renovations to make the inside of this RV just like a mini clinic, just like you would see. For the gas and general upkeep, we plan to spend about $3,000 or so. Again, that's kind of straightforward. Gas, general upkeep of the RV, licensing, registration, things like that. We do target quite a low cost at this because we are only going 3 days a week. Once we drive to get to this convenient location in the lower parts of DFW, we plan to just park and stay from 9 to 5. Miscellaneous medical supplies, we have budgeted about $3,000. In this, we plan to provide like disinfecting wipes, sprays, things like that to keep the inside of the RV clean. We also plan to have like the flu shot waste to just properly get rid of that. $20,000 is going to be budgeted towards medications. This will include flu shots, like what was said earlier, over-the-counter medications, and any other preventative care that we can give adults and children alike. Lastly, our marketing is going to be budgeted about $2,000, just like what Val talked about. Again, we plan to keep this relatively low by putting heavy emphasis on our social media sites. So our goal ultimately is to provide convenient preventative care for lower privileged families in the DFW area. Like Val has already said, we hope to increase attendance in the school and the workplace for higher productivity and a higher education for our kids.
Help us give back, DFW. We want you all to support our Go Care Clinic as part of Texas Health Resources by using your Twitter accounts, your Instagram, your Facebook, by liking us on Facebook, by hashtagging DFW Go Care, as Val said previously. We want you all to provide and to share all the benefits that we will have for our lower privileged communities. We are Go Care. Thank you all.
All right, any questions?
Any questions?